Hello, everyone. Welcome to this session of Psoriasis Awareness. I'm Dr. Anushka Amlani from Integrated Health and Wellbeing Council. This interaction with top dermatologists from length and breadth of India is aimed to spread awareness about psoriasis. Today, on account of World Psoriasis Day, we will be talking to Dr. Bikash Kar, Professor and Head of Department, SUM Hospital, Bhubaneswar. Welcome to the session, sir.
Thank you.
I'd like to set the context for the discussion. Psoriasis as a disease is just not skin deep, a disease that affects approximately 10 million people in India. It is also not fully understood. With the launch of Live Life Limitless, an awareness campaign, we aim to make an impact on the awareness of psoriasis, right from the basic do's and don'ts to the advancement in therapies. Once again, I would like to welcome Dr. Bikash Kar to share his valuable insights with us today. So, as we proceed, my first question to you is, what is psoriasis and how does it impact the patient's life?
Psoriasis is a chronic keratinizing disease and it is a autoimmune disease we can say, and it affects not only the skin, but if you look into the context today, it's called a psoriatic disease. That means you have major involvement of the skin as well as involvement of other organs, or it may be a multi-system involvement where we look for the involvement of other organs. So it can be a joint, it can be the GI tract, it can be your cardiovascular system, neurological system, or simply the psyche of the patient where depression and anxiety are pretty common. So we need to check the patient as a whole, not the skin as a single organ affected with the disease. Regarding quality of life, patient's quality of life definitely takes a backseat here because it's on the skin, so it's visible. So any age after a child is starts going to school, being a visible lesion, everybody keeps asking about the lesion. So that itself is a burden for the patient suffering from psoriasis. So visibility is a boon as well as a curse, both. Because it's visible, so the patient can gauge the disease parameters, the erythema, induration, scaling, and they can also themselves judge the efficacy of the treatment. So that is in a way good, and because it is on the skin, so it takes a lot on the patient's quality of life. Everybody keeps asking, everybody tend to isolate the patient who is suffering from psoriasis. So quality of life definitely takes a backseat, and it is seen that even the sexual life also takes a backseat, especially in people who are recently married and in by chance they also have involvement of genital area with psoriasis. So it is seen that the sexual life also takes a backseat.
Thank you for your insights, sir. Moving on, what is the chronicity of psoriasis and what are the long term complications associated with it?
Chronicity means it's a disease which will probably be there throughout your life. So we need to know length and breadth of the disease as a whole, and it's going to persist and it's going to trouble you throughout your life. We need to modify the disease so that we are compatible at least with the minimal amount of the disease. So chronicity is not a question; it is by default a lifetime disease. Regarding the long-term complications, what we need to understand is it definitely manifests predominantly on the skin, but other organs definitely they are also involved as a bystander. So whether it's the joints or the metabolic components of the CVS or the cardiovascular system, pulmonary system, or the neurological system or the ocular system, every organ gets their own share of involvement in this disease. So we have to evaluate the patient initially on the first visit per se, as well as routinely at regular intervals to rule out involvement of other organs.
Thank you so much, sir. So, moving forward, what are the treatment options that are available for patients when it comes to psoriasis, where it be like conventional treatment options or the topicals?
Treatment options for psoriasis are plenty. So whenever we have plenty of options, that means nothing is a targeted therapy here. So plenty means it all depends on so many factors: patient's age, patient's area of involvement, how long the disease is there, what other systems are involved. So many factors we take into consideration when we decide about the therapy. But as of now, the most commonly used therapy include two methods. One is the topical ways, and other one is the systemic ways. We have a lot of formulations which are used topically and predominated by the steroids, but we have also non-steroidal molecules entering off late in the therapeutic basket in the form of topical vitamin D, calcipotriol, topical tazarotene or retinoids, or topical roflumilast, so many other topical molecules are coming into the basket. And apart from that, we also deal with a lot of systemic molecules, but most of them they are broadly immunosuppressive. So they are also called as disease modifying agents. So probably methotrexate is the one which tops the list, followed by other traditional immunosuppressives like cyclosporin, azathioprine, mycophenolate mofetil, and others. So this is basically the broad classification. Nowadays, we have a group of molecules which are very narrow or which target a particular cytokine in the immune system so that the disease is controlled, and these are called as biologics. So we have three groups of molecules as of now.
Sure, sir. So, moving on, could you help our audience understand why biologics and how do they help live life limitless?
If you compare whatever we have been dealing with the therapeutic basket till date, and if you compare the biologics, the trials are very rigorous with the biologics, and the outcomes are also very encouraging for the patient. So, before maybe if you think of 10 years back, what was happening with the patients of psoriasis, then probably 50% improvement was considered as a landmark achievement for a molecule to be more considered as effective. Whereas with biologics, they are so well targeted, and they target the disease so close, so well, that the outcome is predictable, the outcome is easily achievable, which what we call as PASI 90 or PASI 100 with majority of the molecules. So the standards of the patient-reported outcomes have also gone up with the introduction of biologics. The patient's expectations have gone up, and the effect of biologics is not only on the skin, but also it takes care of the collateral damage that is ongoing in the patient suffering from psoriasis. So, in a way, we can say that biologics not only take care of your psoriasis as such, but also it takes care of the psoriatic disease burden overall.
Thank you so much, sir. So, before we conclude this session, could you please highlight the importance of regular doctor consultation in therapy adherence to live life limitless?
So psoriasis, as you know, it's a difficult to treat disease, and when you are suffering from a disease like this, which is going to be there with your life throughout your life, so it is very important that regarding any decision that you want to implement in your lifestyle, any decision that you want to implement in your food style or exercise pattern or the way you live, or any implementation regarding the therapeutic intervention of the disease, it must be in consultation with the healthcare provider or dermatologist, because we understand the molecules of the drugs better than the general population, and probably the dermatologist will definitely guide you regarding the effects and adverse effects, what to expect and what not to expect from the molecule. When do we want to achieve the results? Suppose a person has got a marriage function in the family and he wants to achieve a clearance at a particular time, so accordingly we can custom make the therapy. So it's always better to stay in touch with a caregiver or a dermatologist for use of the therapeutic molecules that we have. Regarding biologics, they are wonderful molecules. They have definitely changed the therapeutic scenario in psoriasis treatment. What is more important is the continuation of the drug survival in case of biologics. So patients need to be in constant touch, because we are not only targeting the skin, but also we are targeting the other systems which are likely to be involved because of the inflammation load. So in that case, if you are in touch with the dermatologist or the healthcare provider, then you know where you are in the spectrum and what complications you are likely to expect and how well you are doing in the therapy. So I think that that's all regarding the therapeutic intervention, and that is how a patient can enjoy best of both the worlds.
Thank you so much, Dr. Bikash, for your valuable insights. Do you have a message for the audience on the World Psoriasis Day?
So it's like any other chronic disease. So you take it just like any other disease, but what is more important is stay compliant, stay true to your disease, and knowing that the disease is a multi-system disease, you have to be in regular consultation with the therapy giver.
Thank you so much, sir. Thank you for your time.